to this educational video specifically targeting parents with young children as we discuss RSV bronchiolitis. But before I get into the specifics of RSV bronchiolitis, I want to review the respiratory tract with you. So the respiratory tract is comprised of your upper respiratory tract and the lower respiratory tract. The lower respiratory tract is where RSV bronchiolitis is going to specifically target. So that starts here where your larynx and your trachea meet. The trachea is also known as your windpipe. That comes down into your bronchus. From your bronchus, it branches out into your left and to your right bronchus. The bronchus continues further into breaking through to your bronchioles. The bronchioles continue further into these little air sacs called alveoli. And that comprises how airflow is going through your respiratory tract. So RSV bronchiolitis, what exactly is that? Well, RSV stands for respiratory syncytial virus. Bronchiolitis is the inflammation of the bronchioles. So that's going to be this area here. RSV is the specific pathogen that you usually will see with about 1/3 of all bronchiolitis infections that occur every year. So what's happening? Well, you're going to have narrowing of these small airways. So that's going to be this area here. Because of that narrowing of that area, it's also going to cause other symptoms to occur, such as increased mucus production. So that's going to obstruct the airflow of your respiratory tract. So how is RSV transmitted? Well, RSV is transmitted through respiratory droplets that can go through your nose, your mouth, even your eyes, and then continue to spread through your respiratory tract. Usually when someone's been exposed to RSV bronchiolitis, they'll start to develop symptoms about 5 days later. Other symptoms that are going to occur aside from the increased mucus production is going to be rhinorrhea, so definitely a runny nose. You're going to have probably a decreased appetite. You're going to have coughing, fever, and occasionally you're going to have some wheezing as well. How long does that last? Well, it can be anywhere to 3 to 7 days usually. But children who have a history of prematurity, chronic lung disease, or even heart disease, and immunosuppression are probably going to have the symptoms a lot longer. So how do we treat this? Well, all we can do with RSV bronchiolitis is really supportive therapy. And by supportive therapy, I mean that we're going to have to suction your child quite a bit. So this is 2 examples of different types of suctioning that I have. This is your traditional bulb suction syringe. The bulb suction syringe does work to help get that mucus out, but we don't recommend using this one as much anymore because it does harvest bacteria in the bulb once you've tried washing that. So what we recommend is for you to throw this away once that illness has subsided. The one that we do recommend is the nose Frida. So the nose Frida works with having a little collection chamber that goes up to the nose of your child. It continues and it has a tubing that goes to the person or the parent's mouth, and then from there they are able to suck through and the mucus is collected in that little collection chamber. So how do we determine if it's even RSV? Well, really the only way to tell if it's RSV is going to be through a respiratory viral panel. So how do we prevent this from passing even further? Lots and lots of hand hygiene. Definitely washing your hands is going to make such a big difference for you not to be continuing to pass the virus back and forth. Other things to do would be to avoid close contact with sick people. We definitely want to have you cover your cough and your sneezes. Avoid touching your face if you haven't gotten to wash your hands yet. Definitely cleaning and disinfecting all surfaces, including toys, is going to be very beneficial. And then, of course, if you're not feeling very well, make sure you're staying at home because you don't want to pass that any further. And then remember, RSV, just so you are aware, is the most common diagnosis that affects children 5 years of age and younger. Infants are especially the most vulnerable. So definitely taking care of your children is going to be very important so they don't catch this RSV bronchiolitis. Thank you.